There. Can you see me? Guys, we are having some technical problems today. I usually throw that countdown clock on and it is not working, but we have a really exciting show today. Please stay tuned. I have a surprise offer that we're going to be talking about. Today, we are actually going to be gifting you a very special promo code, something that we don't normally do. This is a code that is 25% off. So keep in mind that when we are on Boxing Day or on Black Friday, the most we ever do is 20%. So I have a coupon code for you today. It is live25. Let me see if I can type that up and throw it on the screen so everyone can see it. Again, bear with me because I am having technical difficulties today. There we go. Can you see that? Is there a code there? Is it working? Is it working? No, it is not. Oh, no. Edwin, can you throw that up in the chat? I am struggling today, everybody. There we go. I did it. I did it. Here we go. Live 25. This is for the next 25 minutes. So during the course of our live stream, it is currently 12:01 p.m. Eastern Time. For the next 25 minutes, the code LIVE25, L-I-V-E, will be getting you 25% off any Dr. Ho's product on our website. So head on over to drhonow.com. If you want to come join the chat, you can chat with us at drhonow.com. Be sure to sign up for our email so you never miss a show. You can follow us on our socials at Dr. Ho Now, and you can chat like our friend Lawrence. Lawrence, welcome back. It's always nice of you to join us. I don't know if you heard Lawrence. Join right now, and we have Live 25 for 25% off of our products at drhonow.com. So super exciting that we have that. Only good for 25 minutes. I'm thrilled because usually for even Black Friday, the most we do is 20%. So who's working hard for you? I am working hard for you. Here we go. Okay, so we also have a special guest today, which I'm very excited about, is Dr. Anthony Chan from Cachet Rehab. So I'm going to bring him. We're going to do a little split screen. I'm going to bring him on here. There he is. Wait, here we go. Guys, technology. Here we go. Dr. Chan, hello.
Hey. Glad to be back.
Great. Oh, awesome. Okay. Dr. Chan has some exciting tips for us today about we're going back to basics. We're rewinding it. We are doing proper lifting techniques. And he's going to actually take the lead on this, everyone, not just because he's a skilled professional, but I actually threw my back out this weekend. I was doing some gardening. I did not take my own advice. Didn't stretch properly before or after. Because I wasn't doing anything I thought needed it, but then it was a little sore, and then my dog jumped on me, and that was the end. So accidents can happen at any time. Very unfortunate. So Dr. Chan is going to be showing us some proper lifting techniques. He's going to talk to us about back pain, how to prevent back pain. I'm going to listen intently because I'm currently suffering with back pain, but I'm going to be sitting here. We're all going to follow along with him. And don't forget, for the next 25 minutes, use that promo code LIVE25. You're getting out of bed now. Nancy, you and me both, friends. That is so funny. Okay, here is Dr. Chan. Stay tuned after. If you do have questions for Dr. Chan, throw them up in the chat. I will read them off to him as soon as he's done so that we'll get all your questions answered. And we're here to have fun today, everyone. We're here to learn about back pain. I will be paying attention specifically because I'm currently injured. But all right, take it away, Dr. Chan. Here we go.
Thank you, Kathy.
Oh, that's me. There we go.
All right, everybody. So as Kathy was saying, it has been a very common issue. People getting their back injured from gardening, from lifting improperly. That's one of the most common mechanisms of injury that we've been having in the last month or so with the nicer weather. So I'm here today. Let's just go back to the basics. Let's see how we can lift properly so we don't injure our back, okay? So let's pretend that we're going to be lifting this box here, okay? Pretend it's going to be heavy, okay? So let's go over some wrong techniques first, okay? A lot of patients come in, when they actually bend down, the most obviously wrong way of doing things. If you watch my back, we just curl down and lift like this. The main problem here, our lower back, it's rounded like that, right? Rounded like that, no support. The muscles are not engaged. And if we lift up, that's when we easily pull the joint and muscle right there, okay? So let's think about, athletes and weightlifters. When they lift, where exactly do they lift? Some would say lift with their knees, right? That's actually not the right thing. So let's demonstrate that. If we bend with the knees, if we go all the way down, you see how all the strain goes into my knee joints right there? And if I lift up, yes, that's saving our back, but the problem is our knee joints are going to give, and that's going to get damaged in the long run. So you're going to say, well, Dr. Shannon, what do I do? Like I was saying, so with weightlifters, when they do deadlifts and squats, and we think about it, where are the biggest muscles in our body? Is it our back? Is it our knee? Well, technically, it's around our legs and our glutes. So that's what we want to use. When we use those big muscles, that's going to save our back, okay? So let's demonstrate. What we want to do with the heavy item, it'll be in front of you. One of the biggest tips is you want to keep it as close to your body as possible, okay? The farther it is, the more weight and tension goes onto back. So keep it close to your body. Next, what we want to do with our knees, slightly bent, not all the way, slightly bent like this. And the next part, the key thing, we have to keep our lower back arched. Like I was demonstrating in the beginning, if we round it like this, we easily injure the back. So keep the lower back arched, and we use the hips as a hinge, okay? As we go down, not bending with the knees, we're bending with the hips. Going all the way down, secure grip, keep the heavy item close to the body, and we lift up like this. The main thing also with the heavy item, you don't want it to be to the side, a little bit twisted like that. Again, same thing, you hurt your back directly in front of you. So going down, knees slightly bent, lower back arched, hold on properly, right in front of you, and up. That's the most basic way of lifting and the best way to prevent any lower back injuries. If we actually look at the spine here, why I say we have to keep our lower back straight like that, the spine here, if the joints are locked and the lower back is straight, then everything is secure. All the muscles keep everything tight. When we round our back, that's when you have all the movement and you can easily pull a joint or injure the muscle right there. Definitely do not want that. All right. In terms of lifting, so that's the basics of it. Let's see if Kathy has anything else to say.
Let's see. Oh, there I am.
All right.
I figured out how to get myself on the screen. Wow,
There
we've been having some trouble today. But Dr. Shan, thank you so much. I definitely could have used that this weekend as I was hauling heavy things of sand, or not sand, soil in my garden. I was also hanging some hanging like trellis things. So that was, I think, part of my problem as well. But
so that
I
back
think
belt
it's
would have been
really,
helpful.
yes. So if everyone's wondering, I am currently wearing the triple action back belt to try and recover my poor sore back. But it's really helpful, I think, what you said, Dr. Shan, because I think for so many people, uh, we let like kind of TV or movies or what
Hmm.
we see influence us. And I, totally agree with you in that I've always thought you're supposed to lift with your knees, not with your back. So
Hmm.
I'm really glad that you talked about the big muscles that we're using, not the joints and not like the parts that bend, but the big muscles to lift. So we have some questions for you, Dr. Chan. Okay,
All
so
right.
we have Claire, who says that she works from home now and she sits in front of a laptop for way too
Hmm.
long. I totally hear you, Claire. Are there any stretches that can help with back pain from prolonged sitting? So this is almost the opposite, Dr. Shan. So instead
Hmm.
of, a back stretch or proper lifting technique, is there something
Correct.
that we can do if we're sitting still too long? If if there is there a good back stretch just to kind of get things moving again after we've been
For
sitting? So it's
sure.
almost the opposite. Yeah.
Yes, for sure. I mean, nowadays, especially since after the pandemic, a lot of people are just working from home. And when you work from home, you end up just sitting 6, 7, 8 hours straight. You're not traveling, you're not commuting. So your lower back just gets fatigued. So before we even talk about exercises and stretches, I know you mentioned Claire, right? You're using a
Yes.
laptop. So the way that is positioned, laptops are actually not good for your back because the screen's attached to the keyboard. So you end up being in this hunch forward position. So before we even go into stretches, I definitely recommend if you can get an external monitor and an external keyboard, that in itself would help with your back posture so then you can straighten up a little bit already. After that, though, in terms of stretches, you want to keep it simple. You want to keep movement. So when you get up, let's try to do it together. Follow along, okay? Obviously, try to stand up because you're sitting all day already. When you stand up, you're just going to do some simple range of motion exercises, okay? Keeping your, feet about shoulders width apart. You're going to slowly just bend down, let the body hang. And the key here is you want to be slow, okay? Any fast movement, that's when you pull your back easily. As you go down, you lean forward, grab one leg, hold for a couple of breaths, over to the other side, hold for a couple of breaths, nice and easy. And then as you come up, you don't have to lift your body. Push your body up like this. So you're not using the back muscles, you're using your arms, okay? Next, obviously, side to side. Hold, keep it slow. Good stretch on the sides and obliques here. And then to the other side again. Lastly, you do want to have a little bit of extension, but obviously not all the way back. So with your hands supporting your waist, straighten up and just hold and breathe. That way, now we just went all directions for your back, your core, and your sides, stretching everything out. Takes about 2 minutes. Set a timer on your phone so that you're not sitting for hours straight. Every 30, 40 minutes, get up, do a routine like this, save your back.
Save your back. Oh my gosh. Couldn't we all definitely use that right now? Save my back. I think that's actually a really good suggestion, Dr. Chin.
Mm-hmm.
Is there, it's something we're always saying here, movement is medicine, and that if you do sit for
Mm-hmm.
too long, you can become stiff. You can put
Yes.
a lot of pressure on those joints. So I love the stretches you gave us. And I think it's an important tip that you showed us, that we bent forward, but we also bent backwards. Because I think
Mm-hmm.
a lot of the times we're a little afraid of getting that full range of motion, and we'll do the front and
Correct.
sides and we kind of ignore the back a bit. So
Yes.
that's a great tip.
Mm-hmm.
Clara also wants to know, how does she know if she should get a chiro adjustment? And Mary, I did see your question. I'll get to your question in just a second, okay? But Claire wants to know, how does one know if they should go visit the chiro?
I mean, to be honest with you, when you're feeling any stiffness, well, when you have pain, obviously, yes, seek help, seek medical professional help, get it treated. But even when you just feel that tightness, that soreness, very, very common with people working from home, sitting at the desk, that's already a good time to come in, for a check, for a tune up, because that way you can get things loosened up before it becomes an injury. So whenever you start to feel some discomfort, that's a great time already. Because I always say prevention is better than intervention.
Oh, prevention is better than intervention. I'm going to steal that. That's really good. And clearly, I should have called Dr. Chan when I started to get a little stiff. Instead, I ran around my house and my dog jumped on me, and now I'm in a lot of pain. Which does tie into Mary Lai's question. So Mary Lai wanted to know, how does the triple action back belt help in conjunction with these techniques? So from the prevention side, the triple action back belt has, I'm going to stand, see if you can just have a big close up of what I'm wearing today. But the triple action back belt does have the core support. So it does have the kind of Velcro there. And what I've been using to help my back is that it does have that pump. So I am able to get the lumbar support. Now, I think if I, had done the proper warm up and I had done some of those stretches that Dr. Chan just recommended before, and just kind of warmed my body up, I probably wouldn't have gotten as sore. And then, if you are going to be lifting heavy things and you do need that support, it's great to know the technique. So I was clearly not lifting with my glute muscles. This is a good tip that I will take going forward, lifting with muscles and not joints. And also,
now we know.
Now we know. Knowing is half the battle. It's like when we were little and we watched G.I. Joe. It's like knowing is half the battle. So this is a great tip, and it's something I will certainly take to heart going forward when I am carrying heavier items. And yes, for myself, and with I believe with the chiro adjustments as well. When you're doing chiro physiotherapy, they do often help to relax the muscles by using like TENS, EMS, NMES laser. There's a lot of different things that you guys use there. I'm currently, it's paused, but I'm currently using the Dr. Ho's Pain Therapy Triple Action Back Belt. So I am getting some TENS, EMS, and NMES on those sore muscles, which does feel really nice, especially that I have the extra support from the Triple Action Back Belt. So Edwin, do we know how much time is left on the sale? 10 minutes. Oh boy, guys, 10 minutes left on our live 25, which is 25% off. This is really exciting. I'm glad that we got to do this kind of in honor of Dr. Chan joining us, that we have this special promotion for everyone who is tuning in. That live 25 code will be good for the next 10 minutes, my friends. Lawrence, these are fun and educational shows. Thank you. The educational side is Dr. Chan. I hope that I make it a little fun. That is what we're aiming to do here. And I do want to thank everyone for joining us. If you did miss today's show, you're just kind of tuning in these last few minutes while the sale before the sale ends. We do these shows every Tuesday at noon Eastern. It's a little bit of a lunch and learn so that you can, learn a little bit more about health and wellness during your lunch break, or in Lauren's case, who's joining us from the West Coast, you can kind of wake up and have a little chat with us. Join the chat if you're watching on one of our socials on Instagram Live, on Facebook, or on YouTube. You can chat with us here at www.drhonow.com. And if you missed today's show and you want to recap, and maybe you just want to rewatch what Dr. Chan has been sharing with us, you can catch replays at drhonow.com/pages/watch-us-live, or you can tune into our YouTube, Facebook, or Instagram. You can use, you can also, can we throw Dr. Chan's Insta up in the chat, Edwin? You can also follow Dr. Chan, who is
that's right.
a very, very informative, and he's got a lot of great videos on his channel that you can watch, and you can follow him as well. So I think it's at Dr. Anthony Chan over on Instagram. So you can go follow him there. If you don't want to miss any of these shows, you can sign up for our emails or get notifications on our social channels. This Friday, we have a special Ask Me Anything, where we're going to kind of go through the ins and outs. Mary, oh, sorry, I'll get to you other question in just a second. This Friday, we are going to go through the ins and outs of how to make an insurance or benefits claim for our products. Here in Canada, they are a Class 2 medical device, which means a lot of benefit plans or health spending accounts will cover. So we'll kind of dive into that on Friday. And then next Tuesday, we have a little bit of a pain relief on the go show. So we'll talk about how you can kind of do pain relief wherever you are. Mary, question for Kathy. Did you wear your belt and still get injured? No, Mary, because sometimes I don't take my own advice. I was out with my kids in the garden. They were very excited. We've been growing beans and tomatoes, and my son's been growing these little strawberries that we started. And then we were trying to get one of those hanging planters and hanging it on the fence. So as I was tying twine around this planter, I was just kind of out with my kids. So I didn't think to warm up. I didn't think to grab my belt. I didn't do any of the preventative things that I'm often telling you guys to do. So listen to what I say, not what I do, and take a page from Dr. Chan's book where prevention is better than intervention. So that is very true. So that is what happened to me. I was just trying to make my kids happy, and I hurt myself. Because then the
That's
dog
right.
goes
Actually,
also.
a lot of patients come in, when they're not in pain, every 4 to 6 weeks just for a tune-up, Doesn't mean that, they're injured or anything. They come in because when we do the adjustments, the joints get released, your muscles also loosen up, and, you get back into shape doing what you want to do throughout your day, playing sports, sitting at the desk, working, playing with the kids, just enjoying life because you want that mobility, right?
Yes. Yes, absolutely, Dr. Chan. That is a great point. So I think it's a fantastic idea if you do need that tune-up, if you do need to go in. We're well-oiled machines, right? We need those tune-ups.
That's exactly.
So,
Exactly.
I think we have just under 5 minutes left on that promo code. I am going to sign off right now. So you guys have about 5 minutes to go shop, buy your things, get your discount. 25% off is more than we've ever done here at drhonow.com. So I'm so excited that we got to share that, even if it's just for a short period of time with you. I hope to see everyone this Friday for our Ask Me Anything. And next Tuesday when we talk about pain relief on the go. Thank you, as always, to Dr. Chan over at Cachet Rehab. Please check out
Thank you for
his
having me.
Instagram channel. Yes, so it's at dranthonychan.chiro. And we're so thrilled that you all could join us today. I love doing these chats with everyone out there. Love hearing from everyone. So thank you so much for joining us. And until next time, we'll see you all then. Bye.
Thank you, everyone. Bye.